Prioritization is the key for NCLEX. You can't take the exams without mastering your prioritization. I'm going to show you how you can navigate these questions, different style of questions, how to go about it by mastering it. I call it Stop Overthinking NCLEX Priority. Let's get to it. How do you answer questions? All of the questions, I'm going to show you strategies to answer it. Always start from the back and ask yourself what is being asked. Then after you know what is being asked, you use it to find the buzzword. When you find the buzzword, rewrite it on your own. And when you write a question on your own, you take in charge of it. And out of that, you see that the answer choice pop out like a candy. Therefore, what do we have? Which medication-related issues should the nurse address first? Prioritization first. A nurse is assessing 4 clients. There's 4 of them. In the mental health clinic, you know it's a mental health question. I've underlined the buzzword. I need to address one first. 4 patient mental health. What is that? Divide the question into 2. Look at the situation and what is happening. I give you metaphenidate. Your heart rate is 110. It's a stimulant. I expect your heart rate to go up. It's not a problem. Quetiapine is what? Antipsychotic. You have to recognize the medication first. You have what? Daytime sedation. That's what they do. They give you sedation. You become sedative with those medication. You get drowsy a little bit. Trazodone. Also, what does it do? Orthostatic hypotension. Experience dizziness when upright. Based on that, you can tell that number 4 is the right answer. Escitalopram, SSRI. What is happening? Not sleeping for 48 hours is causing insomnia. It's a suspected finding. What do you want to do? You have to be sharp. If you have 1 second, which of these conditions is causing a lot of problem? They are all expected finding, but one of the expected finding is more dangerous. I said be sharp, not expected. But some situation, you are going to have expected finding. All these 4 are expected finding. Which one is dangerous? Number 4, if you're not sleeping for 48 hours, it's going to be a problem. You're going to have mental issues. You're going to, whatever condition you're going to have is going to worsen. But among all of them, number 4 is more dangerous, right? So this is the way you should tackle it. Trazodone causes dizziness when upright, orthostatic hypotension. Tell them to take the medication at night or get up slowly. But if the patient has not had sleep for 48 hours, it's more dangerous. So that's number 1, is down. Number 2, and nurse is monitoring a critically ill client with the history of what? AFib. EKG show rapid ventricular response of 180 beats per minute. Which intervention should be prioritized? Once again, read it from the back. Prioritize. What is the problem? AFib. What is causing? Rapid ventricular rate of 180. That means you have atrial fibrillation. Your atria is fibrillating, and what is happening? Your ventricle is also responding to a point of 180. How do you answer these kind of critical care questions? Think about it. AFib management is number 1. Is the patient symptomatic or non-symptomatic? They've not told you anything that the patient is having symptoms. That means it's affecting their hemodynamic. That means their blood pressure is dropping, they have a dizziness, they have diaphoretic, the mental status. So this patient does not have symptoms. If they don't have symptoms, they have rapid ventricular response. You want to control the rapid response before they develop symptoms. Anybody who has AFib with no symptoms, best thing to do, control the rate. If they have symptoms, what do you do? Synchronize cardioversion. Therefore, based on that, preparing to do something is too late. We have 180. Beta blocker is better. I'm monitoring for symptoms. He has ventricular rate of 180. I'm not going to wait and monitor for oxygen saturation. I'm going to wait and treat this disease process because he has no symptoms. I can't wait until they have symptoms. Anticoagulation is late finding. So 3 is a problem. You shouldn't anticoagulate right now. This is an acute problem. Which intervention should the nurse prioritize to reduce the risk of complication during surgery? Keyword, reduce risk of complication. Therefore, I should do something to prevent complication. 60-year-old, History of what? Smoking, hyperlipidemia, hypertension. Who is scheduled for what? Surgery. The client has a history of what? MI 5 years ago. What can you do to prevent complication during surgery? Administer aspirin. Ensure the client is NPO for 8 hours before surgery. Monitor oxygen via nasal cannula. Teach the client about post-operative wound care. Think about it. Monitoring something during surgery is what? I have to pick an answer that will help with surgery. Wrong answer. Teaching them about post-operative, they said during surgery. That's the buzzword, right? Administering oxygen via nasal cannula. What do you think? Is they going to help him with oxygen surgery? The thing is to prioritize reducing the risks. Patient has heart attack before, and they're going to have surgery. In order to prevent further complication, previous heart problem, I'm going to give them aspirin. You're going to make them NPO anyway to prevent aspiration. But the most important related to what? Heart attack in the previous life is going to be what? Aspirin. Giving them aspirin will prevent complications. It reduce the risk of complication during surgery. If you want to pick one of them specific for this client, it's not NPO. Number one is aspirin. Of course, we're going to make them NPO, but this question is asking you, is a prioritization. This is why it's a little bit difficult. Think about the situation and what you want to do once again that will prevent the problem is to give them an aspirin. If he's scheduled, one thing you want to know is the patient is scheduled for what? The patient is scheduled for surgery. It does not mean they're having surgery now. We don't know when. So this is future problem. So the most important, the key word is scheduled for surgery. Therefore, being scheduled for surgery is to prevent future problem is aspirin. Which finding should the nurse report immediately? A client with schizophrenia is prescribed what? Ziprasidone. What do you know about Ziprasidone? Ziprasidone causes QT prolongation and it causes dizziness and other things. But which of these do you want to pick? Report mild dizziness when getting up, QT interval of 52 milliseconds. Even if you don't know, think about it. Dry mouth and then experience weight gain. These are all signs and symptoms of antipsychotic. You have to know it. Antipsychotic, you're going to gain weight. Okay. Orthostatic hypotension is classic for antipsychotic. Anticholinergic is classic for antipsychotic. Even if I don't know, compared to all this, if I'm being sharp, what is that? Thinking about breathing, electrolyte shock, sepsis, airway pain. Based on that, this is a shock problem. When your QT prolonged, blood flow decreases, your heart slows down, and it's a problem. But this is how you can translate B sharp into prioritization. But even B sharp not expected. This is an expected finding, expected finding, expected finding. It causes QT prolongation, expected finding. But which one is more dangerous to be sharp? I'll pick number 2. Number 5, and this is assessing a client with a chest tube. Which finding requires immediate intervention? Bring your content regarding chest tube. Know the component of each chest tube and what is being done, what you should expect in each component of the chest tube. If you know it, then you'll be able to answer the question easily. Continuous bubbling in the water seal chamber, you should not see continuous bubbling there. Drainage of 5 ml, 50 ml in the collection chamber is not enough. Subcutaneous emphysema around the insertion site is suspected. Tidling in the water seal chamber during inspiration is suspected. Therefore, what is your answer? Continuous bubbling is not expected in the water seal chamber, and that is number 1. Which client is appropriate for discharge? Who is supposed to go home? And this is determine which client to discharge to create a bed for a new critical admission. Whoever is stable and everything is being done, not everything, at least 90%, and they can go home and continue. Post-op appendectomy is walking independently, his blood pressure is normal. Think about it, he goes home. AFib started warfarin, his INR is not normal, it stays. Diabetic admitted for ketoacidosis and is what? Is still requiring IV insulin. is not ready to go home. Asthma, experiencing moderate wheezing after nebulized treatment, still wheezing, but it's moderate, it's not ready. Number one goes on. The nurse is aware of 4 clients. Which client should the nurse assess first? Prioritization, be sharp. Would you want to see Aprazolam? It's a benzos. What does it cause? Dizziness. Okay, expected. Citrulline, SSRI, will report excessive sweating. I don't like it. Sweating when your symptoms going up is serotonin syndrome. I don't like number 2. Aripiprazole is what? Antipsychotic. It causes mild headache. It's not a problem. Duloxetine, SSNRI, will complain of constipation. Expected. Would you want to see? Number 2, excessive swell and sweating is serotonin syndrome. We got to see it. Simple, straightforward questions. Did not want to make it so hard, but straightforward so that when you master them, no matter how hard they make it, you follow the same strategy to answer the question. Which of these clients you will see first? Same thing. You got to be sharp. If you need more, check out damn class. There's a lot of prioritization, the understanding of the be sharp. But this is the way 90 questions I can get you. As you go up, the question get harder. I go like in the swing seesaw. You go up and down. Make it lower, the higher as you go through the cases, right? After a building collapse, you are part of a triage team. Which of these clients you should see first? Would you want to see? Client with the suspected spinal cord injury, no respiratory distress. The key word in answering prioritization, once again, divide it into 2. Figure out what is the problem and what you should worry about. Suspected spinal cord injury is a bad problem, but what is the problem? He has no respiratory distress. I ignore it. Capillary rate fail of more than 4 seconds, and he's pale, he's in shock, fractured arm, he's not bleeding. I leave him alone. Scalp laceration, and so what? Who do I see? Number 2. Who should the nurse see first? A nurse in emergency room is receive 4 clients. Same thing, divided into 2. Asthma patient reporting shortness of breath. I don't like it. Client with suspected wrist fracture. And so what? Severe headache and a slurred speech. I don't like it, right? Nausea, vomiting for 2 days, dehydration. Would you want to see asthma, reporting shortness of breath? There is no evidence of what? Respiratory distress. I'm just not saying retraction, using accessory muscles and all those things. Severe headache and slurred speech, he has stroke. We got to see him. Number 3. A client in a cardiac unit trigger a telemetry alert. So the tele unit, there's alert from 4 clients. Who you see first? Sinus, the same thing. Strategy, look at it. Sinus Brady, this is what your heart rate is. I have sinus and ventricular tachycardia. I have no pulse. I have occasional PVC. I have AFib and ventricular response. Which of these rhythm is dangerous? Bradycardia, 58, less than only 2 points below 60, but I did not give you symptoms. Don't worry about it. Tachycardia, I have no pulse. VTAC, no pulse. It's a problem. It's a pulseless VTAC. What does that mean? VFib, dangerous. Patient heart is not working. You better shock them. PVCs are not bad. AFib, ventricular response, no symptoms. Let it go. Number 2 is your answer. Which client is a priority? 4 clients you assessed at the beginning of the shift. Would you want to see client with new onset confusion, delirium, bad? I'm receiving IV antibiotic for pneumonia. I have pneumonia. I'm getting treated. Don't worry about it. I'm diabetic. I have glucose of 200. It's too high. And so what? I have no symptoms. You can give me my insulin later. I have an order for discharge. You can wait. I'll come and talk to you later. A new onset confusion. I got to see. On the pediatric unit, which client should the nurse assess? You see, I went everywhere, right? 6 years old, backing cough. You have croup, mild retraction. Not that bad. If the retraction is really bad, yeah, I know, right? 4-year-old, temperature of 102 and febrile seizures. Hey, you're going to go with seizures. When you go with seizures, it's an airway. Be sharp, airway problem, right? 10-year-old, broken arm. You're requesting pain. I have time. I'll come and see you. 2-year-old, no urine for 4 hours. Well, I can come and check you. Somebody who is having airway issue, number 2, who is going to go into seizures, I got to see. Which client is most concerning? Which results is most concerning? The same thing. And then she's reviewing lab results for 4 clients, right? Hemoglobin of 11 after surgery, of hip surgery, probably bleeding, right? I don't like it. INR of 2.5 in a client with warfarin, that's expected, right? White blood cell of 1,000 in a client receiving chemotherapy, that is severe neutropenia. Hey, you're going to go sepsis. We got to see him. Glucose of 150 in diabetes patient is not a problem. So 3 is your problem. Who should be attended to first? Client with what? Severe burn, over 70% of the body and conscious is going to die. It's a multi-casualty event. You want to save somebody you can save, but as a severe injury, the red person, penetrating chest wound, absent breath sound, he has pneumothorax, is the one you can save. Compound fracture, heavy bleeding, also bleeding, right? Scalp laceration and stable vitals. 2 and 3 are red. But who do you want to see first? Somebody with absent breath sound on the left side. You got to see before the bleeding person. Airway. Which client should be prioritized for immediate care? Immediate. I have to do something, not future. I have to do something, not the risks of the problem. This is another problem that affects people with prioritization. They worry about the risks, the future risks, the things said immediate, right now. So, ambulance arrive, multiple patients. Who do you want to see? Open fracture, the bleeding is controlled. Don't worry about it, right? Unresponsive with snoring. He probably is in shock, right? He's unresponsive and he's snoring and he's having probably airway issue. Visible deformities to his shoulder. Very stable. Yeah, shoulder problem. Client who is alert, he has bruising in his abdomen. If you're unresponsive and you're snoring, hey, I got to check your airway. Your bleeding is controlled. Your shoulder is deformed. I'm not worried about it. So number 2 is dangerous. Which task is appropriate for the nurse to delegate to the UAP? How do I do delegation? I know you know it. Whatever you want, you can go anywhere to go watch how to do delegation. But the way I do it, UAP, anything that does not require thinking, no thinking, and and ADLs. That's all. No thinking. Ambulate a client who has knee surgery 24 hours. Yeah, I'm just working with you, right? Monitoring require thinking. Assisting with feeding in the client who has dysphagia. I got to assess you, right? Perform steroid dressing. It require thinking. I cannot do that. Therefore, number 1 is your right answer. And like I told you, straight to the point, no beating about the bush. That's the content. That's how you should treat prioritization. Don't overguess. Don't overguess. Which assignment is most appropriate? And there's delegate tasks to a nearly high RPN. RPN, what can you do? MMR most. That's the way I call it. MMR most. That means monitoring, reinforcing teaching, giving some medication, doing some special tests. That's all. Administering IV push medication to a client who has chest pain, no, it's not good. Chest pain is unstable patient. Monitoring a client receiving blood transfusion the first 15 minutes, no, RN has to do it. Educate the client about discharge instruction, RN will do it. Performing a wound dressing change on a diabetic patient, yeah, you can do it. Number 4 is what we give it to you. Good luck with that. The patient is in labor and delivering sadly report difficulty breathing. What is the nurse priority? Is in L&D, sadly difficulty breathing. Go figure out why she has difficulty breathing. Is it a harmonic problem or anything like that? Administer oxygen via face mask. Check fetal heart tone. Start IV with normal saline. Notify the obstetrician immediately. Why do you want to call the doctor? Don't worry about it. Why do you want to give them fluid? They have difficulty breathing. Why do you want to worry about the baby? Worry about mother before the baby. Therefore, number 1 is your right answer. You see the way I approach it? Treat the patient, not somebody else. Which accident victim the nurse should attend first? A nurse witnessed a motor vehicle accident, right? All these questions, you can stop it, answer it, and see the way I'm answering it. Like I told you, it's going to be fast, but stop it, then answer it, then see the way I'm approaching it. Who, motor vehicle, a bunch of people, conscious patient with angulated left fracture, that means the leg is broken, right? Unresponsive patient with the weak cardiac pulse, is in shock. A patient walking around with minor scrapes and abrasion is fine. A crying infant with no visible injury is fine. Number two is in shock. See him. What should the nurse do first? The child is brought to the emergency room after ingesting an unknown quantity of acetaminophen injection. Took some drugs. We don't know. What would you want to do first? Prioritization. You got to be sharp. Which one of this will save the individual? Draw acetaminophen level and see how high it is. Give them activated charcoal to stimulate emesis. Contact poison control for their recommendation, or assess the patient and monitor their vitals. Assess them and see how bad the medication is causing problem. Of course, we're going to check level. We don't need to activate emesis. We can contact the poison control. But the most important, like I said, assess them and see if you need to intubate them. You need to do something. Treat the patient. Who should the nurse choose? Nurse must discharge somebody. Okay, who would you discharge? Resolve UTI on oral antibiotic. Your UTI is gone. You take an antibiotic. Probably you should go home. You have a new onset AFib. You're receiving IV medication. You're not ready to go home. You have hip replacement. You still need assistance with walking. You can go home. Yeah, chest pain that you need a stress test. You can go home. One need to go home. And let's walk into a client's room and find the oxygen tubing disconnected. You walk into the room, disconnected. Prioritization 101. Be sharp. Is disconnected from the patient. What is the first thing you want to do? Do you want to go reconnect it to the patient? Do you want to check the patient oxygenation? Do you want to call the respiratory therapist? Or do you want to secure the tube to the wall? Always, always, always assess the patient before you intervene. I do not tell you he's in distress. If he's in distress, well, you got to figure out why he disconnected. Patient is fine. What do you want to do? How do you want to know that he's in fine? Check the patient. And how do you do that? By checking their oxygen saturation. If I see the SAT is 20, hey, I will do something quickly. Right now, see if the patient is in distress. If the SAT is 20 and you reconnect the thing, it may not help. You may probably have to max the patient. So because of the defected tubing, you don't know. So the first thing you want to do, check the patient oxygenation. The next, find a client laying on the floor. The same thing. What is the first action? Assess the client for injury before you call people, before you notify the doctor, before you document incident report. Straightforward, right? Which action should the nurse take first for a client in DKA? DKA. What is the problem? Osmotic diuresis, because their sugar is too high, and they have diuresis. They get dehydrated. When they come in, number one thing is fluid. I'll give you insulin, fine. I'll monitor your potassium, fine. I will assess your glucose, but I need to give you a ton of fluid. Therefore, number three is your right answer. I told you it's content-based prioritization. Which intervention should be prioritized first? Same strategy, same thinking, same concept, adapt and close way, and nurse is caring for a client with what? Acute pancreatitis. What is the problem with pancreatitis? You have inflammation of the pancreas, and it causes water absorption, and you get dehydrated. It's like being burned in the fire. Your back is being burned. The pancreas is being burned. How do you stop something that is burning? Pour water on it. Second, giving pain medication. Therefore, what is over there? Administer pain medication are prescribed. Encourage a client to consume high fiber diet. Assess the client for jaundice, and ensuring the client is NPO to rest the pancreas. This is a test-taking strategy, right? You're not going to worry about jaundice right on. They should not be on high fiber diet. Right. I told you number one is to stop the burn. How do you stop the burn? Nothing by mouth, by not stimulating the pancreas and then pulling water on it. Give them fluid. Then you give them pain medication. You can give them pain medication, all right. If they're eating, it's going to make it worse. You want to make sure you stop the pancreas from doing its job. The more it secretes, the more they have pain. I know I got to give them pain, but they need to be MPO. I will prioritize MPO rather than giving them fluid. Number 4 is my answer. What should the nurse do first? The nurse is administering digoxin. The lab results show potassium level at 3.0 content. Low potassium, hypokalemia, worsening digoxin. Therefore, what do? Don't give them digoxin. Hold the digoxin and notify the doctor. Administer the dose as ordered. Increase the client potassium intake. You can do that. You need some order from the provider. Monitor the client for signs of digoxin toxicity. We don't know the level of digoxin toxicity. We need to hold it. Make sure potassium is high enough before we can give it. Number 1 is the right answer. The next is educating a client about taking furosemide. Dehydration. You're going to lose water. Which statement by the client indicate understanding? I should limit my fluid intake. No, you're going to be losing water. You're going to get dehydrated. You got to keep up your water intake. I need to take this medication with food. There's no restriction on it. I should monitor my weight daily and report significant change. If you lost a lot of water because you dehydrated, you become orthostatic and fall down. Therefore, that's more better. I should avoid food high in potassium. No, you should eat something that has potassium in it because it's going to become hypokalemic. 3 is your right answer. Which laboratory value is most important to monitor? A client is prescribed warfarin. What does warfarin do? Vitamin K dependent factors. And how does it do that? It blocks those factors and increase your INR and PT. Platelet, heparin does not affect it. It does not affect your hemoglobin. You're left with 2 and 3. PTT is what? Heparin, and the warfarin is in charge of what? Increasing your PT and INR. So number 2 is your right answer. What is the next priority? A laboring client is 9 centimeters dilated. She's dilated. She's reporting severe back pain and feel the urge to push. This is maternal age, if you know the content. 9 centimeters, back pain and feeling the urge to push. She's probably in stage 2, right? Trying to progress through. She has to be completely like what? 10 centimeter dilated, 100% effaced before you can tell them and the baby will come. Therefore, what is the next thing the nurse will do is to assess and see whether they get to the point that they can push. You don't push until you pass completely effaced and dilated, which is 10 centimeters and then 100% effaced. Therefore, allow the client to start pushing with contraction. Wrong. Perform sterile vaginal exams to see whether she's ready to push. Turn the client onto a side to relieve back pain. No, it doesn't do that. Probably you have to apply counter pressure. It depends on the position of the baby, but this probably is due to the pelvic. The baby is pushing in the pelvic. That's why she's feeling that. Notify the air care provider immediately. No, it's not needed. So the best thing to do, assess the mommy and perform sterile vaginal exams. If you need more OB, I'll make it easy. Check Adapt NCLEX so you can join our crash course if you want. Email me when you're ready. Take care of yourself. And next is caring for a newborn with jaundice. What is the priority intervention? I have jaundice. What do you want to do? We want to improve the jaundice and let the jaundice get better. What do you want to do? Increase frequency of breastfeeding, give them vitamin K, hydrate the baby, check the baby hydration status, or the newborn under radiant warmer. It's a trap, right? Trap question, right? If you put them under radiant warmer, it's going to warm the temperature. Yes, it's different from phototherapy. Remember, jaundice, the treatment is phototherapy and hydration. Monitor the hydration status. Monitoring is not going to help you. Rather than doing something, you increase frequency of feeding, baby get hydration, and they pee and they poo-poo, and the blood, and then the jaundice get better. Urination and voiding is what will get away the jaundice. Therefore, that is the key concept. Vitamin K is not related to jaundice. So it's a trap. Which finding require immediate intervention. Pregnant lady, preeclampsia on magnesium. If you're magnesium, it puts you down. Your excessive magnesium drop your respiration, your urine output, your saturation, your reflexes. Reflex of 1, respiratory of 10, blood pressure is normal, urine output is normal. You have 1 and 2. Which one you want to pick? Respiration of 10 is bad. So this is the one we need to do something about it. It's straightforward maternal health. A client with major depressive disorder state, I feel hopeless, right? And can't go on. What is the next priority? Notify the healthcare provider. Ask the client about suicidal thought or plan. Encourage the client to express their feeling. Provide information about support group. Look, I can't go on. What do you think? I feel hopeless. I can't go on. She's checking out. He or she is checking out. Find out if she want to kill herself. Assess the client by suicidal thought and plan. If you know the content and you see the question, the answer choice will pop out like a candy. And that's what I'm showing you how. If you get the content from the question, ask, buzzword, and then put it together, rewrite it your own. You see the answer choices staring at you like a candy. Which client can be discharged to free up a bed? Who can go home? If you're ready, everything is fine. That's the content. Then look at the answer choice and see who is ready. Diverticulitis, you eating. Come on, pack your bag. Hypertension is requiring frequent blood pressure. It's not ready. Colostomy, you need to be educated. Not ready. Crohn's disease is on steroid, IV. Not ready. 1, you eating, go home and eat some Thanksgiving dinner. What is the nurse initial response? And then she's caring for a client with what? Schizophrenia who is experiencing auditory hallucination. Content. Psychotic patient, auditory hallucination. Key concept for your NCLEX. Find the content of the hallucination. If it's a visual one, don't worry about it. If it's a tactile one, don't worry about it. Don't reinforce it, just acknowledge it. But if it's an auditory, go for it. Go for the dagger, find the content, make sure that doesn't want to kill you, themselves or somebody else. So what are the voices saying to you? Finding the content. The voices aren't red. No, you're supposed to acknowledge it. I will stay with you until the voices go away. It's not relevant. They're not going to go away. Have you taken your medication today? Irrelevant. What are the voices saying to you? Is the right answer. Number 1 is the right answer. And next, with the bipolar disorder is in maniac state, is admitted. What is the most appropriate next intervention? What do you want to do? Encourage group therapy, provide structure, a low stimulation environment, allow the client to explore their interests freely, provide frequent high-calorie diet, mental health content. Bipolar in maniac state, what you do? No group therapy initially until they can talk to you. Second, provide structured environment and low stimulation. Third, provide what? High calorie diet. But for prioritization, what do you prioritize? Mental health, remember, physical need. Which of this is a physical need? High calorie, frequent high calorie. This is a hard question, but you got to think about it. Physical need is the most important. So provide high calorie food, frequent. So you give them finger food, and that is a prioritization for you. A nurse is preparing to administer medication for 4 clients. Which client should the nurse see first? I need to give you medication. Who I want to see? That is my content. I've rewrote the question. I have 4 patients. They need their medication. Who do I want to see? Somebody with blood pressure of 160/92 and is due for their blood pressure. Somebody with a chronic pain is due for pain medication. Somebody with AFib is scheduled for warfarin. Somebody with hypoglycemia, I need to give them glucose tabs. Be sharp, but not expected. 1 second. Hypoglycemia need a glucose tab is more likely to get what? Symptoms. And if you check, be sharp is there. Be sharp right there. Hypoglycemia, H is hypoglycemia and hypotension, right? Shock. No, hypothermia. Though hypoglycemia and hypothermia, those are the things you worry about. Hypoglycemic patient, I worry about you. The rest, you have time. We will deal with you later. What should the nurse do to minimize this risk? A client with dysphagia is at risk of this aspiration. Prevent the risk of aspiration. That's all. That is what the question is asking you. Answer choice should fix that. Offer large portion of pure food, large portion, make the answer wrong. You want to give them thick liquid, right? Instruct the client to tilt the head back, not forward. Back is bad. They're going to aspirate forward. Keep the client in high follow position during meal is better. Upright. Straw is not good. They're going to aspirate. What is your answer? Number 3. The client complained of pain rated 8 out of 10 despite receiving pain medication. What should the nurse do? I give you pain. You still complain about pain. Well, I got to assess what is the medication. Did it work? And where is the new pain you're having? Notify the healthcare provider for new order. No, he's going to ask me, how does the patient look? Reassess the patient pain for 15 minutes. He's complaining about 8 out of 10 pain. I don't have time. Implement non-pharmacological pain. If I give you pharmacological pain is not helping, how would the non-pharmacological pain help? What is left in number 4? And that's even if you don't like it, pick it. Don't overguess. Don't say, I don't understand the answer choice. Pick the answer choice, even if you don't understand it. If you've been able to eliminate 1, 2, 3, 4 is your answer. Assess the site of the pain. Yes, where is the new pain now? And how effective the medication is your right answer. What should the nurse prioritize? A client with the cast in the leg report increasing pain and numbness in the toe. Cast and numbness in toe is compartment syndrome. 101. Don't do anything. Don't give them new prescription. Don't call the doctor right now. You need to assess and make sure we have a compartment syndrome and let the doctor know. Don't elevate the leg above the level of the heart. That means blood flow is decreased. Keep the level, keep it at the level of the heart. That means the right answer is number 2. Assess them. Who should the nurse see first? And nurse receive a tele alarm for 4 clients. AFib with a heart rate of 120. Sinus rhythm, frequent premature ventricular tachycardia. AFib with no pulse. VFib with no pulse. And pacemaker showing paced ventricular beat. We saw a similar question. I intentionally repeat the same similar things, but I changed instead of ventricular fibrillation, I put VFib, a VTAC, I put VFibrillation, no pause. 3 is your right answer. It's the same thing, the same strategy. Which client should the nurse prioritize for immediate care? Client with chest pain on relief with nitro. Client with suspected rib fracture and shallow breathing. Client with asthma with mild wheezing. Client with DVT and swollen calf. Don't get trapped. I call it be sharp. I have DVT and I have calf. Probably calf swelling. Probably you anticipate, probably they may have PE later on if you don't do anything. Fine. Asthma patient is reporting wheezing. I expect him to have wheezing. I suspect rib fracture. He has shallow breathing, but I never tell you that he has pneumothorax, anything. If it's also bad, right? And if you have chest pain unrelieved by nitro, this is acute coronary syndrome. This is a heart attack. It's more dangerous. Therefore, this patient, we need to see them. So number 1 is your right answer. A patient arrived in the ED emergency room with stroke symptoms that started 2 hours ago. What is the priority action? When they give you a stroke patient question, don't worry, don't stress. Write this fast. Facial drooping, asymmetrical hand drift, right? And speech and the time of onset. I've given you the time of onset, and we know they told me you have stroke. What do I want to do? I want to know if I can treat them. How do I know I can treat them? Get a CT scan. If there's no blood in their head, I give you medication, TPA. Of course, you got to rule out if this is just hypoglycemia, right? You don't have time to do detailed neurological exams. When they come initially, detailed neurological exams is deferred. There is no detailed neurological exams at that time. So number one is your right answer. The nurse is caring for 4 clients. Which client should the nurse see first? Same thing. He has head injury, post craniotomy, surgery, right? GCS is 14, a little bit confused, right? New onset headache and reporting nausea and photophobia, that is ICP. Multiple sclerosis, and I'm reporting weakness expected. I just had seizure, I'm drowsy, but I'm arousable, I can wake up. Well, who do you want to see? New onset with ICP issue. Number 2 is more dangerous than number 4. Don't get trapped. Just a seizure is drowsy, but I said arousable, right? I have new ICP issue, I'm vomiting, and I'm photophobia. Hey, ICP, you got to take care of me. A client with diabetes has blood glucose of 350, fluid breath, and what? Cushman respiration. That's DKA. What do you want to do? IV fluid. This is the same question I gave you, DKA, but instead of putting DKA there, I just give you those signs and symptoms to know what it is. Do you want to check potassium, ABG, IV fluid, insulin? No. Give them IV fluid, number 2. And this is caring for a client with SIDH. Do be sharp, not expected. But if I give you a bunch of expected finding, know which one is going to kill you. Which finding require intervention? What is SIDH? You retain water. If you retain water, you become hypoglycemia. You gain weight. You become thirsty. Your urine specific gravity is going to go high because you cannot pee. But which one is going to kill you? Hyponatremia, because you go in seizures. And therefore, number 1 is your right answer. The pediatric client present with a high-pitched cry, bulging fontanelle, and irritability, or ICP issue. What do you want to do? Give them acetaminophen, wrong answer. Let the doctor know, better answer. Put them in the prune, bad answer. You got to raise their head up, right? 30 degrees at least for ICP. You don't need to get a venipuncture right now. So the best answer is call the doctor, number 2. The client with asthma is admitted with acute asthma exacerbation, which finding require immediate intervention. That means I got to do something now. Use of accessory muscles is airway compromise. You have an issue. Saturation of 92 is fine. Asthma patient is going to wheeze. My wheezing is suspected. His respiratory rate of 20 is not normal, but it's okay. But if you're using accessory muscle, you're going to get tired easily. Number 1 is your right answer. And it's assessing a laboring client with preeclampsia. I have preeclampsia. Which finding is most concerning? What is the problem? That means the more than 20 weeks pregnant, they may have other signs and symptoms with preeclampsia, but which tells me this is severe. Proteinuria, okay, is bad. Blood pressure is bad. Deep tendon reflex of 4 is worse. You got about to have seizure. That means you are hyperreflexia, and this is more. Plus 2 PT edema in the lower leg is expected, but 3 is more dangerous. This is more dangerous. The blood pressure is not too high. Anything 160 is severe, but deep tendon reflex of 4, you are about to have seizures. Postpartum client with bulgy uterus and heavy bleeding is being monitored. What's the next priority action? Stop the bleeding, stop the bleeding, stop the bleeding. Give them medication or massage. Medication will take time to work. Best way to decrease bleeding, massage, massage, massage. Notify the healthcare provider. You can do something before you call them. Start IV. Of course, we know they may be bleeding, but it's not going to help with the bleeding right now. You got to transfuse them. Massaging them, putting the uterus under contraction, it will help with it. Pitocin is going to help, but not right now. I can do something without an order. So what I will do, I'll massage the patient, which finding require immediate intervention. A client is 6 hours post-op following abdominal surgery. He just had surgery 6 hours ago. Pain 7 out of 10. Pain that will kill you, your life, limb, eyesight. This pain is not going to kill him. No bowel sound is something I expect. Serosanguinous drainage is something I expect. Tachycardia, firm and distended abdomen is B-sharp moment. B-sharp moment, B-sharp moment. This is peritonitis. I see number 4 I'm picking that. I got to intervene. In a multi-trauma, which client should you see first? The red, the one who's in trouble. Find the black, eliminate it, and pick the red. Open femur fracture, active bleeding is one red. Closed head injury, fixed, dilated pupil. That's black. Rib fracture, paradoxical breathing is another red. Suspected spinal injury and intact sensation. It may be probably yellow, but don't worry about it. It's not a big problem. You have two. Okay, open fracture is bleeding, and you have paradoxical breathing. That's like what? A flare chest. Two is bleeding, and three, no, one is bleeding, and two is having airway issue, paradoxical breathing. If you don't fix it, they're in trouble. So three is more dangerous than two and one. Two is dead, one is red, three is red. Those two red, the biggest red will be number three. What should the nurse do first? A client with the acute kidney injury report palpitation and potassium of 6.8. That means they're having symptoms associated with potassium. You have to treat it. You got to lower the potassium down, but before you lower it, make sure that your heart is safe. So give them something to stabilize their heart. Give them K-isolate. It will take some time. They have to take it by mouth. It will take time for them to poop it out. It take a while. Dialysis take a while. IV calcium gluconate stabilize the heart and it's the best one. EKG, it's not going to help you. I know what is going on. It's having heart palpitation. I know sodium, potassium is already 6.8. I'd rather give you calcium gluconate right away based on that. Somebody will say, get the EKG, but you're having palpitation. You're showing me sign. The time is taking for me to get the EKG while you're having symptoms. It's too late. Your heart is quivering. I need to stabilize your heart first. I'll give you calcium gluconate. Number three is your right answer before I get the EKG. Which finding require immediate intervention? A nurse is caring for a client with urinary catheter. Patient has urine output of 20 ml for the past 2 hours. It's not good, right? Pink urine after bladder irrigation. Yes, there's more bleeding. Foley catheter injected 2 days. It's too long. Fine. Client report bladder fullness. They have urinary retention. But two is renal failure, right? 20 ml. No, one is 20 ml per hour for over 2 hours. You have renal failure. So one is dangerous. Compared, this is what I expect. This one is too long. I got to do something. But the word is immediate. You always have to go with words. Okay? It's been 10 days. Nobody have done anything about it. This one, I got to fix it right away. Bladder fullness, I got to fix it. But this, you're not paying. I'll take care of you first. What is the next priority action? A client with bipolar is pacing in the aisle, shouting loudly, and refusing medication. Bipolar is probably a maniac. What do you want to do? Give them lorazepam, provide safety for the other patient and staff, attempt to de-escalate the patient verbally, call the healthcare provider. Safety, safety, safety is the right answer. So safety of the other patient is much better. The client with sepsis is receiving IV antibiotic. The next note, a new rash, wheezing, and swelling of the lips. That means what? Allergic reaction. Is having an anaphylactic reaction. What do you want to do? Stop the antibiotic. Give them diphenhydramine, and the IV antibiotic is still going. The key thing is if you're receiving poison and I'm giving antidote, it's not going to help you. You stop the poison, then you give me antidote or give me the treatment for it. So the best thing, stop the infusion and notify the healthcare provider immediately. Apply oxygen at 2 liters. It's not going to help right now. I did not tell you they have a respiratory issue right now, but all the signs and symptoms look like anaphylactic. Therefore, the best thing is to what? Stop the infusion. A1 is the right answer. What is the next first action? A client with tracheostomy tube is in respiratory distress. What do you want to do? He has trach in their neck. Check the patency of the trach. Give them oxygen via the trach. Notify the respiratory therapist for suctioning, call it a rapid response. Think about it. I have trach and I'm having respiratory distress. You got to figure out why the trach is not working. If it's clogged, that's why I'm having respiratory distress. You can suction me. If you bag me, give me oxygen through the trach, I'm already having respiratory. If the look at it, look at the answer choice. If the trach patency is affected and you put oxygen through there, it's not going to work. If you notify the respiratory therapist, it's going to ask you what is going on. Did you assess the trach? Is the trach inside? Is the trach out? Rapid response, you got to do something before you call them. So one is the right answer. Check the patency. Who's the safest to go home? Same thing. You need a room. Who can go home? Pneumonia, receiving oxygen, 2 liters. Cholecystectomy is tolerating diet. Cellulitis is getting IV antibiotic. TI is need an ultrasound. If you eating, you go home. Cholecystectomy, eating, go home. This guy is still on 2 liters. It stays. Which client the nurse should prioritize first? Leg laceration, control bleeding. There's no more bleeding. 50% of your body is burned. But what? You have pulseless and you have apneic. You're dead. You have open fracture and you have weak pulse. You are in shock. Exposed brain and fixed people. You black. So, right? 2 and 4 are dead. 1 and 3 is okay, but 3 is in trouble, is in shock because of weak pulse. Therefore, we got to see them. Number 1, fracture is laceration is controlled. Which is appropriate to discharge? The same thing. Who can go home? I have angina. I have cardiac catheterization 4 hours ago. I'm not ready. Heart failure who gained 2 pounds with mild edema, right? I'm not ready. Admitting for pancreatitis, tolerating clear liquid diet for the first 24 hours. I look like I can go home. DVT with a heparin for 48 hours. I need Coumadin. Therefore, who can go home is number 3. Which client can safely be discharged? Same thing, same concept. We need some bed. COPD, now I'm on my oxygen at home, not just hospital. Home oxygen, that means that's what you use. You can go on with that. Wound with cellulitis requiring dressing frequently, you're not ready. Bowel obstruction is taking oral intake, may be ready. IV fluid, dehydration, reporting dizziness when standing. And you can see, right? 2 and 3, 4 are definitely ready. 1 and 3, think about it. Small bowel obstructions, tolerating oral intake. I never told you if it's solid, liquid, some intake, fine. But 1, he has COPD, is on his own oxygen. This is what he's on. That means you can't do anything better for him. He should go home. 1 should go home. Which client should be treated first? It's a natural disaster, a bunch of people injured. You want to pick those you can fix. Chest wound, diminished breath sound on one side, airway, I can do that. You're dying. I got to fix you quickly. Tibial fracture, and then pause. Okay, good. 25% of your body is burned, and you complain about pain. You're going to leave. Suspected neck injury, probably you have spinal cord injury with tingling in your arm. It's fine. 1 breath sound on one side is decreased. I got to fix you. 1 is your right answer. And then provided teaching to several clients. Which client with diabetes should the nurse prioritize for education about what? Risk reduction. Once again, risk reduction. They all have diabetes. Well control blood glucose and no symptoms where I don't need to worry about you. I have recent hemoglobin A1C of what? 8.2 and your peripheral neuropathy is bad. You're having symptoms already. I got to manage your blood glucose well. Otherwise, you have kidney problem, you have heart attack, you have stroke. Newly diagnosed diabetes with a family history. Well, newly diagnosed, I got to teach you. Who is pregnant and is requiring insulin? It's fine, but none of them have symptoms. The one who have symptoms is disease is really, really bad. For risk reduction, if you don't do anything about 2, it's going to get more complication. It's having peripheral neuropathy. So 2 is more dangerous. Once again, stop the video and then answer the way you want, then see the way I approach it. Which finding require immediate intervention, multiple traumas, the multiple patients with lab work. See which one is consistent, which one you need to fix. Potassium 5.2 with the kidney disease is suspected. Hemoglobin 7.8 is too low, and I have fatigue and pallor. I'm having symptoms. 1 does not have any symptoms. 3, 134, and I'm receiving IV fluid. No symptoms is still not bad. Sodium, right? Glucose of 150 and you have diabetes, it's okay. 2 is bad. Which one can safely go home? Same thing. Admitted for seizure management who has been seizure free for 36 hours. Well, you don't have any seizures anymore. You should go home. Hysterectomy, still having a bunch of pain, not ready. Pain, you can't discharge a patient with a lot of pain. They'll come back to the emergency room. Kidney injury and you have less than 30 ml of urine. Yeah, you're not ready. You have PE and then your INR is not normal yet in terms of when you're on warfarin, 1.2. So you should stay. 1 can go home, even though you have seizures, but for 36 hours, no seizures, you go home. And then scale for several clients. Which client should the nurse see first? Same thing. Diabetes, your glucose is 200. It's bad. Well, are you having any symptoms? I have to be sharp. If I have 1 second, I'm not picking you. Worry about hypoglycemia. Type 2 diabetes. I'm reporting dizziness and sweating. Hey, hypoglycemia in disguise. I got to see you. Hyperthyroidism. You have a heart rate of 105. I expect your heart rate to go up, but you're not having symptoms. Crohn's disease, complaint of bloating. Good luck with that. I'll take 1 second and I'm going to see number 2 because he or she has hypoglycemia, dizzy and sweaty. So 2, I will see. Who is the best candidate? Who should go home? Syncope and normal orthostatic. Well, you don't have any signs of syncope anymore. Your blood pressure is normal. You go home. Pacemaker and it's not capturing. You stay. Bradycardia who has chest pain. You stay. A-flutter. You're starting anticoagulation. You stay. So 1 goes on. That's the way you don't overthink these things. Same thing. We need a place for capacity is over full. We need a place for 1 person to go home. CHF, you're diuretic. Most people with CHF goes on with diuretic. So 1 goes on. Indwelling catheter due to remove tomorrow. Well, you can't go on with your catheter. You stay. GI bleed, your hemoglobin is still low. You stay. Pneumonia, require physical therapy. You stay. 1 go home. Who should be prioritized first? Multiple clients in the medical surgical unit. You have indwelling catheter, you have burning sensation where you may have UTI, is fine. Peripheral IV that is infiltrated, okay, fine. Post-op day 2, there's 50 ml of serosanguinous of your dressings, okay. You be in bed rest and you have calf pain, DVT, I gotta see you. Number 2. Number 4 is the right answer. 4 is the right answer. I'm trying to simplify. I don't want to overthink it. The way you should approach it, you got to be sharp. Be sharp. It is the way you do it. Who is going to die? That's what you go for. Safely go home. Well, you should, when you're ready, we send you home. Diabetes, hypoglycemia is now eating any stable glucose. Hey, you look like you should go home. You dehydrated, your blood pressure is still low. You stay. Renal failure, you are waiting for dialysis. You can go. Infection, you're receiving IV antibiotic, you can go. Diabetes patient, go home. Read the question the way you want. Change it in your own way. Make the answer choice your own way and become easy to understand it. Which client should you trigger as priority? It's multi-trauma. That means whoever is red, bad problem. You have airway, breathing, you have shock problem, you have chest injury, yeah. But if you have bad head injury, you dead, you go away. Bilateral femur fracture, and you have pulses. Okay, fracture is not going to kill you right now. Open sacking chest wound, you have chest injury, I'm picking you. Aberration, your GCS 15, you are weak. Minor burn to your hand and stable, you good. 2 is my right answer. Which client should the nurse see first? Client with what? Severe abdominal pain and positive rebound tenderness, peritonitis. I got to do something. I have gunshot wound to your leg. There's no bleeding. You're good. You report chest pain radiating to what? Your jaw and blood pressure. You have heart attack. Shock will happen very soon. I got to be sharp. Client with a minor head injury with mild dizziness. Think about it. Peritonitis, be sharp, is sepsis, right? And then gunshot wound, bleeding that is controlled, so no shock, right? I have jaw, MI, heart attack. A, you're going to have shock. Shock sepsis is part of the B sharp. Who do you want to pick? Shock versus sepsis. I'm picking shock, and that is B. 3 is the right answer. Which client should the nurse receive immediate treatment? Respiratory rate of 40, and I'm blue, cyanosis, airway breathing problem. Be sharp. Be sharp means breathing. You prioritize breathing, but this is not in order, right? It does not matter. You don't go that you got to pick B first. No, there's no other system, right? It just these are the one that will help you focus. So this patient has a breathing, electrolyte, shock, sepsis, hypothermia, hypoglycemia, airway, neurological problem, and pain. And that's what I've been using to answer the question, but it's not in order. I look at the situation and say which one is sometimes pain is better than what electrolyte. So you got to pick it, right? So this patient, he has respiratory rate of 40, cyanosis, bad problem, breathing issue, is having airway issue, aversion and active bleeding. I have bleeding here. You see, you're having shock here, right? I'm disoriented and I'm in glucose is fine. Hypoglycemia. This is a classic B sharp question. I'm vomiting after shock and smoking inhalation. This is a trap, right? This is not airway problem. They have carbon dioxide monopoisoning. If I want you to worry about smoking inhalation causing airway, I would say sing or dark sputum, right? This is nausea and vomiting, carbon monoxide poisoning. Hypoglycemia is part of the B sharp, right? And active bleeding is also part of the B sharp. And then cyanosis, airway breathing, part of the B sharp. Who do you want to see? Who do you think is dangerous? This guy. You got to be sharp. A is your right answer. And it's working in the emergency room as 4 clients arriving simultaneously. Who should the nurse assess first? A client with severe migraine and photophobia, expected finding. Client with 10 centimeter laceration to the arm is actively bleeding. We got to stop the bleeding. Something is wrong. Acute shortness of breath, oxygen saturation 89. 2 cannot trump number 3. 3 is dangerous. It's having airway. It's the same thing we saw. It's all B sharp, thinking and standing your ground. Just because this has active bleeding, this has shortness of breath, its SAT is 89. You need to do something first. Dislocation of your shoulder in severe pain is not a problem. Number 3 is a priority. This is a priority for assessment. 39 weeks old gestation, contraction 5 minutes apart. Hey, probably you're about to deliver fine. 28 weeks with painless vaginal bleeding, placenta previa. I don't like it. 40 weeks old with gush of clear liquid. That's water broke. Okay, premature rupture of the memory. 34 weeks old with bilateral leg swelling and fatigue, consistent with pregnancy. Who do you want to see? Right? Contraction 5 minutes apart, or placenta previa, or rupture of memory, or expected finding of number 4. No, 2 is dangerous. So that's the one we see. Placenta previa is more dangerous. The client should receive immediate intervention. Which client? Partial thickness to the face and sink nasal air. Deformed arm and stable vitals. Control bleeding. Suspected spinal cord injury, no sensation to the leg. Fractured femur and capillary refill less than 20 seconds. 2 seconds. Think about it. If your femur is fractured, your capillary refill less than 2 seconds, that means there's blood flowing there. You have pulse. Everything is good. Spinal cord injury, you're not moving. Well, I cannot fix you right now. Deformed arm and vital stable. There's no bleeding. I can't worry about you. You have burn and you have sink nasal air. That means you have inhalation injury. So one is your right answer. Which client should the nurse prioritize? Appendicitis, he has pain and a fever, 101.3 expected. Femur fracture reporting severe pain and swelling, expected finding. New onset confusion and slurred speech. That's what neurological problem. You got to see it. Wrist fracture requiring pain. I'll give it to you. 3 is your right answer. Which client is assigned the highest priority? Amputated arm. You have amputation of your arm and you're lethargic. This is shock. Concussion. Your GCA is 14. It's not bad. Abdominal trauma and your vitals are stable. You have multiple aberration and there's no complaint of pain. Shock should be seen. Number 1 is your right answer. Which client should the nurse assess first during the start of the shift? Who? Colostomy, moderate pain, diabetes, your glucose is 2 before you eat. You have pain post-op day 1, 6 out of 10, requesting pain medication. I give you blood transfusion 30 minutes ago, mild itching, allergic reaction. I got to see you. 4 is your right answer. Do this and you see prioritization will be easy. Which client require immediate assessment by experienced nurse? A charge nurse is determined which client should be assigned to a new graduate nurse. Who should the experienced nurse see? Pressure ulcer requiring dressing, where both of them can see them. Shortness of breath with saturation 88. You need an experienced nurse. Awaiting discharge for newly prescribed insulin. Both of them can see. NG tube and no output in the 4 hours. Both of them can see. Somebody who is in acute problem need to see by the experienced nurse. Saturation of 88. Number 2, experienced nurse should be seen. The nurse team is made up of RN, LPN, UPN, UAP. For this, you stay in your lane, you give the patient to the person who usually is within their purview. A UAP cannot do LPN job, even though sometimes LPN can do a UAP job. In this situation, LPN should do only LPN job. Assessing a client is done by RN. Administering oral medication to a client with hypertension, LPN can do. Developing a care plan is done by RN. Evaluating a client in response to a physical therapy, RN. So what can she do? Number 2. What is the next priority? What is the next priority during the resuscitation? During the code, the nurse is assigned to record all activity. This question is designed to help you think about when you answer a question, every answer choice is in the question. I told you, the nurse is assigned to record all activities. So what is this going to do? Ensure accurate documentation of medication and time administered. That's what I told you is the job of the nurse. They don't monitor the rhythm on the defibrillator. They don't assist with chest compression. They may, but most of the time, the questions say record all activity. Pick an answer choice related to recording all activity. Notify the family of update during the code. I told you, record all activity. Therefore, 1 is the right answer. Which client requires immediate intervention? After receiving change of shift report, who will require immediate intervention? A client who is MPO reporting dry mucous memory. I get it. You may be dehydrated. Client reporting difficulty swallowing oral medication. I got to help you figure out. Post-op day 1, your temperature is 100.4. You may be having infection. But if you have tracheostomy and there's audible goggling sound, no brainer, right? Number 4, I see you. Which situation should the nurse address first? A client with stage 2 pressure ulcer requesting dressing. Maybe I have to look for other options and see if there's bad stuff going on. Client with urinary tract, a urinary catheter complaining of lower abdominal discomfort. The Foley catheter may not be working. History of fall who is attempting to get out of bed, safety problem. Dementia is wandering around. Therefore, if you have 1 second, Somebody is wandering around. Somebody is going to fall. We know she's been falling and trying to get out unassisted. Somebody who has catheter and abdominal discomfort, pressure, and dressing change. They all have problem. But you have 1 second. Who do you think I need to intervene quickly? Then go back to the other one. If you go and change the dressing, the patient trying to get out will be already failed. So I got to see them. Safety, number 3. Which task should the nurse complain first? Assist the post-op client with ambulation for the first time. Same thing. You want to walk, I will ambulate you. I got to be sharp for the first time. Okay. Administer a schedule antibiotic for a client. You have infection. I got to give you antibiotic. Is it more important than somebody who need to get out of bed and I walk him? I don't know. I need to replace the oxygen tank for a client with the continuous oxygen therapy. Look at it. He's receiving oxygen therapy and I need to replace it. If there's no oxygen, it's SAC's job. Would you want to do that? I need to provide hand hygiene before I take for a client requesting a bath. You want to bath a patient or you want to give oxygen to somebody who probably oxygen may be running out, or antibiotic for pneumonia, or who want to walk. You know what to do. Go get your oxygen as soon as possible. Which client should the nurse prioritize for risk reduction in post-surgical units? Same thing, risk reduction, right? This should say Foley. It's spelled wrong. So this should say Foley. So risk reduction, that means I want to prevent complication. I have surgery, I have Foley, my temperature is normal. I have knee surgery, and I'm refusing to take my medication. Good luck with that. I have a laminectomy, back surgery. I'm getting back pain. Yeah, it's going to hurt even with medication. It's going to take time. I have cholecystectomy. I'm not taking deep breath. I'm not coughing. I get pneumonia. I get infection. I'm in trouble. So 4 is bad. Which intervention should the nurse implement first for a client at risk of pressure ulcer? Pressure ulcer, pressure ulcer. That's the key. The bars word is pressure ulcer. Reposition the client every 2 hours. Ensure adequate protein. Apply foam mattress to the patient bed. Perform a daily skin assessment for early signs of breakdown. What do you think? All of them are important. But if I take pressure off by changing you every now and then, it's much, much better. So repositioning is more better. They are effective, but positional change, because the patient does not lay on the bed, this is not going to happen, right? You give them nutrition to improve, protein to improve the nutrition to prevent this problem. You give them foam mattress so that when they lay on it, it does not mean it prevents it completely. Foam mattress is less pressure, but all of them come with me laying on it. Therefore, change me every time will prevent it. So number 1 is the right answer. And let's care for a 6-hour newborn with blood glucose of 39 who is alert. The kid is alert. 39, even though it's low, the blood pressure, the glucose is low, the kid is alert. What you do? What do you want to do? Let the doctor know, give the patient IV dextrose. If they can, what? They are alert and they are not confused. It's a 6-hour old. You expect that. The best way to prevent hypoglycemia is oral intake, not IV. Therefore, 2 and 4 is gone. IM and IV is gone. Let the mommy feed the kid. Easy. So 3 is your right answer. The nurse is reviewing the list of clients assigned for the shift. Which client should the nurse assess first? Fracture femur, I have pain. Hip replacement, I have temperature. Open tibial, and I'm tibial fracture, and I have foul-smelling drainage. I have a cast in my arm. I'm reporting itchiness. Itchiness at the cast, expected. I have open tibial fracture, smelling, sepsis. Hip replacement, temperature 100.8 is not bad. Femur fracture, I know it's going to hurt. Therefore, 3 is bad. The nurse is caring for several clients with hematological condition. Which client should the nurse prioritize for assessment? I have iron deficiency anemia, I'm reporting fatigue and pallor. It's not good. I'm tired. Thrombocytopenia, I have petechiae on my arm, as I expect. Sickle cell, and I report sudden chest pain and difficulty breathing. That's acute coronary syndrome, acute chest syndrome. Polycythemia vera, I'm reporting pruritus. This is all expected. One is expected when you have anemia, you become fatigued and pallor. When you have thrombocytopenia, you have petechia. When you have polycythemia vera, you have pruritus. When you have sickle cell disease, you're going to have pain, but acute chest pain and difficulty breathing in a acute chest syndrome. This is dangerous. It's life-threatening. You got to see them. Number 3. Which client should the nurse prioritize for follow-up in a community health clinic? 22-year-old. He has no HPV vaccine and he wants information. 45-year-old. His BMI of 32. He does not exercise. Sedentary lifestyle. 50-year-old. He has a family history of colon cancer. He has not had colonoscopy. 60-year-old smoke. He is reporting of dyspnea after climbing stairs. Prioritization is an act. If you think about it, straightforward, you will not overguess them. Think about it. Who needs your priority? Who do you think is more dangerous? None of them is having symptoms except number 4. Always think about it. Is having problem. Prioritization is immediate. The 2, 3, 1, 2, 3, we can have time and fix them. They don't need, you can't just grab them and say, hey, I got to do colonoscopy on you right now. You can't get 2. You got to do exercise right now. 1, you can't get in and give you a vaccination right now. Yeah, they need information. 4 is having symptoms. They need to be seen. This is adapting class 90 questions, straightforward, helping you. If you need more, check adapting class. You see it down there. You can subscribe and support the channel. Share the video to your friends, bring them to the channel so that they can learn this content free. If you want more, you can join our membership. You can see it over there. You click on join membership and then help the channel grow. Or you can join adapting class crash course on demand. You can find that on the first part of the video, the first page, and I give you all the content related to where to find information. Thank you for watching and happy Thanksgiving.